I am 23 weeks pregnant today. Not a whole bunch is new with me, like, physically or anything like that. My mood is a lot better than it was. I still get, like, a little bit snippy here and there about things. But I feel a lot better than I was feeling for the past couple weeks, so I'm very, very glad about that. I haven't really done anything different to change that. I know I mentioned I was going to look into starting my workouts again, but I haven't done that. So I don't know if it was a phase, or I don't know, who knows, a surge of hormones or something like that, but I'm feeling a lot better, like, in that regard. I guess the only other thing, like, physically is, like, I am absolutely exhausted. I almost feel like I did the first couple weeks when I found out I was pregnant, like, uncontrollable exhaustion. I can get a full night's sleep. Well, maybe it's not a full night's sleep because I do get up a couple times and I do toss and turn. But I'll get a full night's sleep, or I'll feel rested, but then within an hour of waking up, I want to sleep again. And I struggle to stay awake. Like, sometimes we go out, because if I'm home, I'm gonna pass out on the floor playing Barbies. Like, I can't stay awake. It's so frustrating. I'm drinking lots of water. Maybe I need more. I've been able to drink like 2 cups of coffee a day. I don't want to increase that. So I think it's just that time that I'm feeling exhausted. I do find that when I stand for a long period of time, I get out of breath. Like, if I'm, brushing my teeth and I've just tidied up and I'm putting on my makeup and doing my hair, I'll have to, like, actually sit down and take breaks, or, like, I'll have to sit on the edge of the bathtub and finish brushing my teeth because I literally cannot breathe. Or the other night we went out to dinner and I started feeling this, like, crampy feeling in my lower left side, and I thought, oh, maybe it's like round ligament pain or whatever, but then it kept persisting, and then I noticed that it had, like, moved up to the top of my belly, like right under, like right up my ribs, and it turned from, like, a cramp feeling to, like, almost like a burning sensation. I don't really know how to explain it. All I can explain, it was like burning, but not like heartburn feeling. I don't know. And it got to the point where I actually looked at the clock. I was like, okay, it's 6:21. This has been going on for a while. Like, what the heck? And then I'm like, okay, well, maybe it's gas. Because it started getting really uncomfortable, and it went on for like 2 or 3 hours. I was drinking water. I had food because we went out to eat. And yeah, I don't know what it was. Like, I don't really remember experiencing Braxton Hicks with Zoe, and if I did, it was very, like, nothing. Like, I don't even know if I had it. That's how unnoticeable it was if I did. So I don't know exactly what Braxton Hicks feels like, but my whole belly was like a rock. I had this, like, burning sensation, but it went on for like hours. Couldn't get comfortable. So that was a strange happening. So maybe it was Braxton Hicks. I still haven't even looked it up. I've been starting to give a lot of thought into, like, a birth plan. I'm a pretty laid back person. I've mentioned that before. You've probably even noticed from these videos that I care but I don't care kind of thing. Like, I just kind of just go with the flow. So I don't really have a plan per se. Like, I don't have it all written out, and I don't stress about it or anything like that. My only plan is to deliver the baby in a hospital, and I want to breastfeed as soon as possible, and I want to delay the cord clamping, which I believe my midwife does anyways. I think that's just, like, standard practice for them. But yeah, I've been starting to actually really start thinking about whether I want to go with a medicated birth again, or if I want to go like an unmedicated birth route. I've been doing a lot of reading. I've been doing a lot of watching YouTube videos of other women's experiences, women who have had no medicated births and women who have had both. So I like to see their experiences with each. Like, I've even actually been watching unmedicated births on YouTube. So I know that's not totally an accurate depiction, probably, because I mean, most of these videos on YouTube are edited, so I can't really see the whole thing from start to finish, and how did that woman really feel, and this and that and this and that, all that kind of stuff. I have found a few that I feel are very honest, so that's been helpful. I've ordered a book from the library. It's a very popular book, I guess, with women who want to go the natural or unmedicated route, and that's the, I don't even know how to pronounce her name. Ina May Gaskin. I don't know how to pronounce her name. So I ordered that book from the library. I've been watching a lot of TED Talks and a lot of other educational type videos, not just regular people here on YouTube, so actual midwives, actual doctors, that kind of thing, people who have experienced it and who have worked with it their whole lives. That's been very eye-opening. So far I'm leaning more towards wanting to try that, but the overwhelming message I keep getting from all these people who have experienced it or who have helped others experience it is, you can't go into your labor and delivery saying, I'm going to see how far I can go without needing an epidural or without needing any pain relief. But if I do, I will get it, kind of thing. So, and I laugh because that was literally my exact words with, like, when I was pregnant the first time with Zoe. I said, oh, I'm going to see how far I can go, and then if I need the medication, I'll take it. And literally, I took it. So what I've been getting, like the overwhelming message I've been getting from all these women and professionals is, you have to go in with a mindset like, this is the only way. There is no such thing as pain medication. Like, you have to have it set in your mind that this is literally your only option to get this baby out, is to do it without pain medication. I haven't made a final decision. I don't know what I'm going to choose this time around, but I'm really enjoying the experience of looking into it more. So, I mean, even if I don't, I think having all of this knowledge in my head will even help me, you know, delay the pain medication, or just help me be motivated to get the baby out. I have no opinion about, like, medicated versus unmedicated births. I just think women are rock stars and superheroes in general for giving birth. So whether you did it with no drugs, whether you did it with every drug there is, I have no problem with that. Like, it's your choice, whatever. Do have a midwife appointment coming up on the 16th of September, and that is when we will discuss being sent for the gestational diabetes test, so your glucose tolerance test or whatever it's called. This is probably a little bit controversial, I guess. I opted out of that testing when I was pregnant with Zoe. I don't fully know why I did. I mean, yes, I have a needle phobia, but, like, even this time around, and even after my first time having my blood drawn with Zoe, like, I don't care. So that's not it. I know 100% it's not the needle that I'm worried about. I still haven't decided if I'm going to opt out again this time around. Still having the same flip-floppy decisions on whether or not I'm going to take that testing. I think I don't even know how to explain it because it is such a controversial subject. Like, I keep looking online for, you know, people who have opted out and people who haven't, and people are just, like, attacking each other. So it's kind of hard to just look through pregnancy forums and things like that because everybody's got their own opinion. So I've been looking at, like, medical opinions and I don't know. So yeah, I'm finding it hard to explain here, especially because I know this is going online in the public eye. So I'm sure people will have a lot to say if I end up not doing it. But I don't know. I just don't feel worried about it, I guess. I completely understand all of the risks that go with gestational diabetes, all of that kind of stuff. I am completely aware of that. This is my second pregnancy. I'm not oblivious to what can happen, what the, what the benefits of having this tested and what the benefits are in knowing whether you do or not have gestational diabetes. I just don't feel scared. I honestly do not know how to explain it. I guess there is no way to say it without people like jumping down your throat for your decisions or whatever. I just feel like maybe I have to be scared enough to have the testing because right now I do not feel worried about it. I know your weight and your lifestyle and everything, you could be the healthiest person and you can still develop gestational diabetes, which is what I'm trying to say. I'm not saying that, oh, my risk factors are so minimal, or oh, I eat well and I do this and I'm active and blah 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 blah. I just don't feel worried enough to go for it. Maybe this time around I can I'll be able to say this to my midwife. Like, not that I couldn't say it last time. Just like now I can kind of like articulate that I don't feel worried enough, convince me kind of thing. I've had a friend tell me like, if it doesn't scare you, blah 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 blah, just do it then. Why not want to know kind of thing. And I'm just like, I don't know how to explain it. I don't know. Have at me in the comments. I don't feel worried, and I don't even feel worried enough that I would want to just find out to make sure, that kind of thing. I don't know. I got time. I got time to be convinced, I guess I'm trying to say. So that is pretty much all that is new with me right now, is I'm just kind of giving the actual birth a lot of thought. So I guess I will go ahead and show you the bump. Alright, so there's the belly from the front. And I don't know if you can see this side here. Side. Pull that up. I'm definitely feeling bigger these days. Quite uncomfortable. The belly button is getting more and more shallow each time I look at it. I feel no stretch mark that I can see yet. So those are the biggest things going on with me right now. I do keep getting asked if we've chosen a name yet. We haven't chosen a name yet. We actually haven't even really fully started talking about it yet. I did make a video of baby names that I love, but probably and most likely won't be using. I'll leave that down below if you haven't seen it already. Thank you for taking the time out of your day to watch my videos. As I said before, it is really motivating me to keep doing these. I know there's not a whole lot of like discussions going on in the comments or anything like that, but yeah, it is still really fun to know that people are watching these and liking them and subscribing. Either way, what I'm trying to say is thanks for stopping by and taking a few minutes out of your day to see what I have to say. I hope you have a great weekend, and I will see you guys in my next video.